In just 1 week of assuming office, the PPPC government has embarked on a COVID-19 relief distribution exercise targeting border communities in the hinterland. Thus far, approximately 1,000 hampers were distributed to households in regions 8 and 9.
Close to 600 food hampers were distributed to households in communities in the North Pacaraima, Region 8, as part of the PPPC government's effort to provide relief to hinterland communities affected by the COVID-19 pandemic. The village of Kurukubaru was the first stop, where the team comprising Minister of Amerindian Affairs, the Honorable Pauline Sukai, and Minister of Local Government and Regional Development, the Honorable Nigel Darmlal, along with CDC's Director General, Lieutenant Colonel Kester Craig, delivered 300 hampers to be shared among that village, Itabak and Kanapang. Minister Sukai explained that the aim is to ensure residents in border villages within the regions have adequate supply of food so as to limit their movement, thereby lowering the risk of transmitting COVID-19.
Collaboratively, we have done is that because the border tongues or the border villages are affected, we would like to ensure that the villagers have minimum supplies of foodstuff so that we'll avoid them from leaving their home. We are going to work together with the villages, the leaders, to ensure that we flatten the curve of the COVID pandemic, which has been affecting Guyana.
The team then traveled across the Paramakatoy, where another 300 hampers were delivered, with that community receiving 150 and Tusaneng and Bamboo Creek 75 each. Paramakatoy, the largest populated village in the North Pacaraima, with over 3,000 residents, has not recorded a single case of the coronavirus, even as neighboring Brazil has been declared the second most infected country in the world. Minister Darmlal commended the village for implementing strict measures to monitor the virus and committed to working with the village in order to maintain their status.
We have to make sure that through the Ministry of Local Government and Regional Development, we will work with the Ministry of Health to make sure that the health facilities in Paramakatoy have adequate drugs and other medical supplies to fight COVID and to fight other things. Because whilst we are working on COVID, people are also sick with other illnesses.
Over in Region 9, the team distributed 520 hampers and over 2,000 face masks to assist families. Households in Pataranao, Katur, Baitun, Kwaiko, and Sand Creek in the South Rupununi, and Waweta, Ruperti, Anai, and Arnaputa in the North Rupununi will benefit. At a simple handing over ceremony in Waweta village, Minister Sukai reiterated the seriousness of the pandemic and the need for residents to heed all the measures and restrictions that are in place.
We appreciate the work that has been ongoing. We would want to ensure that the task force refine and its monitoring of everything that is happening. I think that COVID-19 is too serious a health risk to our population, and particularly to the border population, as Letem is to one of the countries with one of the most explosive number of cases in the world. So we have to ensure that our task force is always in preparedness, that we take our monitoring aspect very seriously. We expect that this task force will tell us about some of the recommendations they would like to make since they've been in operation. Obviously, there would have been challenges. Then we would like to be acquainted with those issues. And from there on, I suspect that it will feed right in to the national task force mechanism, so that we can all work together to ensure that we we seriously contribute to ensuring that we take Guyana off a higher risk path.
Minister Darmlal shared part of the government's plan to mitigate the novel coronavirus.
We need to have immediate responses to the affected areas, but we also have to have responses that can allow the areas that are not affected to not be affected. So some of the things we are doing as a government: one, we're providing relief through the CDC, and this is limited relief. rapid response relief. The government is also securing, I think, close to $4.5 billion just to fight COVID. The actual labs to test the blood sample, or sorry, the nasal sample, Guyana only has one. I think, too, that we are in the process of acquiring some more, and the intention of the government is for all of us as Guyanese to be tested.
The residents were also thankful to the government for its swift action in providing assistance to them.
I appreciate whatever comes under this new administration. Thanks a lot.
We are thankful for the aid that we've gotten, and I'm sure that the people who are affected with the COVID-19 will benefit.
The distribution of the hampers was a directive from the President, His Excellency Dr. Mohammed Irfan Ali, who met with his cabinet ministers on Friday last.